if you'd like to go first, I know you have some meetings, and if you'd like to begin questioning, we'll have questioning for 5 minutes. Mr. Chairman.
Thank you very much, Mr. Chairman. I appreciate your courtesy to me. I want to say to all of you, what happened to you is wrong. It's wrong in this country that people should be forced into bankruptcy, that Tatum should face a future where she may not get insurance under the way things operate now, that bankruptcy becomes the only way to wash your hands from these debts, and you all had insurance. Well, Tatum, I want to assure you that if we enact the legislation that President Obama is supporting, your future will be very bright. It's not going to be hindered by your inability to get insurance, yours or anybody else's in this country. Insurance should be that we spread the costs over a broad population, and then those who need the care will have it available to them. But the insurance companies look at it differently. They want to avoid having to pay money. So they don't want to cover people who might be a risk. They exclude you if you have a pre-existing condition. They put lifetime caps. They have annual limits on the out-of-pocket costs, annual limits on the costs that they'll pay. There are so many things they do to avoid living up to what you expected you bought when you paid for your insurance coverage. Now, Ms. Howard, you thought you were buying insurance coverage that would protect you. You knew it was going to require that you'd have to pay a lot of money up front, but then after that, if it was a huge amount, you'd be covered. Isn't that what your thinking was?
That's what I thought.
Yeah.
But that was wrong.
Well, your policy said that if your costs exceeded $5,000, then the insurance company would pay for all of it. Isn't that right?
They did say that. And
so what happened with you is you spent far more than $5,000 because under your Anthem policy, every time you got a treatment, they didn't count that toward your out-of-pocket limits for the $5,000. They disqualified costs of out-of-network treatments and the portion you paid for prescription drugs. Isn't that the situation?
Yeah, and that amounted to roughly $10,000 per year for each of those years.
$10,000 each year for each
of those years while I was under active treatment.
And so even though you exceeded the $5,000, they didn't step up to pay the rest. They just said what you paid doesn't count toward the $5,000. So it kept on. It's almost like a goal that they kept on moving away further and further from you. When you try to stay within network, because they said you have to stay within network. If you go out of network, they're not going to count those costs. How difficult was it to find somebody within their network?
There were some services that were not available in San Francisco.
So you would have to go somewhere else other than San Francisco?
Yeah.
Well, San Francisco is a pretty big city, so I would assume that you're talking about hundreds and hundreds of miles to get the care.
I made the choice to get the care that I needed regardless of the cost.
Yeah.
And that's why I feel like I'm alive today.
And each time you had a prescription filled, you had to pay a co-insurance fee of 30% of the cost. Is that right?
Yes.
And how much out-of-pocket did you actually spend while you had insurance coverage?
It's over $40,000 between 2004 and 2008.
So for the years you were protected, presumably, for expenses no more than $5,000, you ended up spending $40,000 over that period of time.
Mm-hmm.
Mr. Wilkes, your policy had a cap on out-of-pocket expenses as well, but they also had various limitations and exclusions. Can you estimate the total out-of-pocket costs that your insurance did not cover?
In the 6 years, the total that we've had direct and indirect costs, I'd say well over $50,000, if not $100,000. There were some claims that at the very beginning, at the very end, that they said they either did not cover because it was out of network or did not cover because it exceeded the cap, and those two individual claims were $50,000 and $80,000 each.
Well, we started the hearing today. We had opening statements, and some of my colleagues on the other side of the aisle who have opposed health insurance reform said we don't want one size to fit all. We want competition in the system. Well, there's no competition when one insurance company can sell you a plan that doesn't pay over a certain amount of, if it doesn't pay within the cap, or a one size. In other words, what they're saying is competition to exclude payments. And what we need is legislation that would ban the lifetime and annual caps, would have no limits on out-of-pocket costs, no more discriminatory insurance practices. And what we would like is a defined benefit package, so that you can shop around between different insurance claims, and you'll know that you're buying a plan that will cover your needs, and you're going to choose between them based on the price or based on the quality, but not based on what they will cover and what they will not cover when you find out that you really need that coverage to pay for your medical expenses. I hope we will get that bill passed, and I thank the chairman for allowing me to proceed with these questions.
Thank you, Mr. Chairman. Mr. Walden, for questions, please.
Yeah, thank you very much, Mr. Chairman. I just